Hello, my name's Dr. Melissa Oxlade. I'm a registered psychologist endorsed in health psychology, a lecturer here in the School of Psychology at the University of Adelaide, and one of the program coordinators for our Masters of Health Psychology program, along with Professor Anna Johansson.
Hello, I'm Zian Chung. I'm a first-year Master of Psychology health student.
Hi, my name is Gregory. I'm a first-year Master of Psychology health student.
The University of Adelaide offers a Masters in Health Psychology program because we recognise the importance and value of the relationship between physical health, social health and psychological well-being. Across the world, there's been an increasing trend in lifestyle-related diseases and chronic illnesses. We know that much of the burden associated with those diseases can be prevented through appropriate lifestyle modification, and this is where health psychologists come in. So as a health psychologist, you can work with individuals or with populations. So working with populations, we work to help prevent illness and to encourage positive health behaviours. So we might be involved in developing and implementing campaigns such as stop smoking campaigns, healthy use of alcohol, so that we can have those broader implications. Other health psychologists will work on a more individual basis where they're helping individuals or small groups adjust to a diagnosis of a health condition or to manage that condition. In those areas, we may be helping to support people with things like diabetes, cancer and chronic pain. So recognising that people that have skills, understanding health behaviours and how to prevent and manage illness, the University of Adelaide have a Masters in Health Psychology program. We're very proud to be one of only 2 programs in Australia that offer this specialty within health psychology.
At the end of my PhD, I realised that I was really interested in translating research into practice, and that's what made me feel like probably I should do a master's so that I can actually practice and be able to use the skills and the knowledge that I have learned from my PhD into clinical practice.
Yeah, so I came from honours, and it was very early on that I knew that I wanted to be a psychologist, to be working in this field. But I was only doing my honours here where I sort of really know that I wanted to do something related to physical illness. And coming into this course, I find that this has really broadened my perspective, as well as provided me with a lot of learning opportunities.
The Master of Health Psychology program is structured as a 2-year full-time program. In the first year, the students predominantly undertake their coursework study. So within that, they're going to study topics such as evidence-based practice, interviewing and interventions, abnormal psychology, psychological assessment, introduction to epidemiology, the health of individuals and populations, and of course, health psychology. Within the first year, they'll also undertake their first placement out in industry where they work as a provisional psychologist under the supervision of a fully registered psychologist. For us in the second year of the program, the students will complete their second and third placements, having an opportunity to undertake both health promotion roles but also clinical health psychology roles. And they'll also undertake a research thesis on a topic of their choice related to health psychology.
Yeah, so this program will suit people who are interested in physical illness, as well as the different aspects of physical illness, as well as how that intersects with mental health. So essentially it's taking a holistic approach to mental health and physical health. As well as this program will suit people who are interested in the public health aspects as well.
Yes, so if you're interested in this course, you will have to be aware of the time commitment. So in some cases, like in summer school, it can be a bit intensive and you will probably not be able to take part in any part-time or casual employment.
And certainly, the time commitments, as you've indicated, can vary a little bit. So it's very intensive in our summer school when students are on campus from 9 till 5. There's a little bit more flexibility through the year, and we do find that many of our students do work part-time, particularly in the first year of the course. However, it's really important to note that in the second year, when students are out on their second and third placements and they need to meet the requirements of the workplace, students often find that they can't fit part-time employment in the scope of that, whilst also managing their research thesis.
Yeah, so the highlight of the course for me is that coming from honours, where it's really competitive, and coming to masters is a small cohort. Everyone is really supportive of each other. The lecturers are all there for us, helping us along the way and all. So it really gives us a lot of opportunities to learn and be focused on our learning.
Being a small cohort is also a highlight for us. We get to see them grow and develop and see them building confidence over time and see the support that they provide for each other.
As well as we get to hear from a lot of people from the industry. and hear about their experiences, what they do. And it has really been helpful to me, is that I'm able to know what I want to do in the future, what my career prospects are.
And in that sense, we are learning actually not only from our lecturers, but also from people in the industry, from people in the field. And there's just so many different perspectives, so much knowledge that we're kind of like consuming, which I think is pretty amazing.
As well as essentially what I want to say is that there's just a lot of diverse and interesting learning opportunities in the course. And that's the main highlight for me.
I think Gregory and Xian have both raised some really important highlights for them, and building on that, as they both mentioned, we do bring in lecturers from the field who are currently practicing psychologists to share their knowledge and expertise, but it also means that we can give them some background knowledge but also focus on more interactive hands-on learning. Another highlight related to that is we do what are called objective structured clinical interviews as part of our psychological assessment courses and also our health psychology course, where we do bring in paid actors, and the students use our simulation facilities to be able to practice their skills in a more hands-on environment before going out and working with real clients. So they're real highlights for us, being able to draw on the strengths of our colleagues out in the field and allow the students to be exposed to a range of different professional pathways, seeing them grow and support each other and being able to provide our learning in a much more interactive way. I think another highlight is also the placement opportunities that we have within the health psychology program. So it's very important for us that students are exposed to both a health promotion-based placement, but also something that's more that one-on-one clinical health psychology. So we provide placements in places like the Centre for the Treatment of Anxiety Disorders, a general mental health and wellbeing clinic. There's also placements available in not-for-profit organisations, opportunities to work with Indigenous communities, and in the hospitals, working with cancer patients, burns patients, chronic pain. So there's a real diversity in the sorts of placements that students are able to explore as well. So if you're interested in an exciting career to help not only individuals but broader populations as well that might be experiencing a range of different health conditions, or to be able to help prevent illness, then maybe the Masters of Health Psychology at the University of Adelaide is for you. If you have an honours degree in psychology and you're interested in joining this exciting program, please refer to our website for further information.